patient comes in severe pain, a lot of times they're coming into the office in such severe pain because they've got a lot of anxiety about coming into the dentist. I'll hear this a lot of times, this tooth has been hurting me for weeks, sometimes even months. And I've been putting it off, but now it's gotten so bad that I have to do something about it. Well, immediately the first thing that says to me is that this patient is reluctant to come into the dentist for some reason. Sometimes it's financial, usually it's a fear of the dentist issue. They just don't want to face going into the dentist and dealing with this problem because they believe it's going to be a very painful experience for them. And they also, another thing that they fear is being moralized to by the dentist. It's not my job to judge a patient on their situation. If they're in a situation where they have a painful toothache, it's my job to just basically deal with that situation as it is right there and take care of that problem. I give the patient their options. We can keep the tooth by doing this procedure, or we can remove the tooth. Either way will get you out of pain. These are the benefits and negatives of each choice that you make. What choice do you want to make? It is not my job to look at the patient and make a judgment on them, on their hygiene, on their values, on why they've let their mouth get into a certain condition, because I have no idea of what this patient has been through in their life. They may have been through some awful experiences that just never allowed them to get into a dentist. And since I'm just meeting this patient for the first time, I need to be as objective as possible and not make those kind of moralizing judgments on patients, because it's really not my place to do that. My name is Dr. Eric Meeker. I look forward to treating you and your family.